Hi, everyone on the phone. My name is Elizabeth Harper. I'm the Director of Workforce Research at ASTHO. I'm relatively new, so that might be a new name for some of you. So I wanted to welcome everyone and thank you for joining the call. The Council on Linkages wanted to get these groups together to chat about the updated core competencies. I believe they had a previous meeting with you to solicit your input on before they were updated, so now they're circling back around and presenting them to you. And I think on the phone we have peer networks from ASTHO, the accreditation coordinators, senior deputies, and also the human resources and workforce development directors peer network, in addition to the ASTHO Affiliate Council Workforce Work Group. So those are the individuals on the phone. Terry Dwelly is also joining us, and he's going to give just a brief outline of this effort and the presentation. So Terry, if you want to go ahead.
Yeah, thanks, Elizabeth. And it's a real pleasure to be with you. And I've just been asked to give just a few comments, I think, about the Council on Linkages core competencies as a state health officer. I am the ASTHO representative council member on the Council on Linkages. And the Council on Linkages is meant to link or bridge the gap between academia and public health practice. And I think all of us realize that there has been and probably still is a gap or a gulf between those two entities. And there's been a lot of dialogue, discussion on how to appropriately link those, the practice community and academia. And there's been some incredible work that's been done by the Council on Linkages that has moved this forward, even though I think all of us realize that we still have a ways to go. The Council on Linkages identified 8 competency domains, and they're presented in as 3 tiers of competencies under each domain. Tier 1 being the entry level, Tier 2 for managers, supervisors, and Tier 3 for senior managers and CEOs. And those 8 domains, I think it might be worthwhile to just hear the titles of them. And the first one is analytics and assessments. The second one is policy development and program planning. The third is communications. The fourth is cultural competency. The fifth, community dimensions of practice. The sixth, public health science. The seventh, financial planning and management. And the eighth, leadership and systems thinking. Now, as both a council member on the Council on Linkages and also a member of the Association of Schools and Programs of Public Health Competency Work Groups, there are 12 domains in the ASPPH work groups, and there's 8 in the Council on Linkages. As I look at those, it appears to me that the Council on Linkages competencies more clearly align with practice than the ASPPH domains, even though, to be honest, there is significant overlap. Now, a good practical example, I think, of the Council on Linkages alignment is just an example that we have in North Dakota. The University of Minnesota Midwest Center for Lifelong Learning recently did a survey of local public health units in North Dakota and identified a list of training needs. And on the top of those lists were 2 things, grant writing and budgeting. And I think we realize that grant writing and budgeting obviously aligns very well with the financial planning and management domain in the Council on Linkages. The competencies and skills in the Council on Linkages 8 domains also are crosswalked with the 10 essential public health services. So when I'm looking at this as a state health officer and a practice public health person, why should I be interested in the Council on Linkages competencies and skills? Well, there are 2 big ones that I just want to leave you with and as we then go on into the other parts of the webinar. First of all, accreditation. Accreditation that many of us are going through is based on the 10 essential services. And as we mentioned before, the Council on Linkages, competencies and skills are linked to those 10 essential services. But the second reason is that I think this competency and skill base of Council on Linkages sets the base for practice workforce training for not only our current but also our future workforce. And once again, the Council on Linkages, I think, domains very closely reflect those practice skills that we need. So with that, as an introduction, I'll turn it back to you, Kathy, to introduce our speakers.
Thank you, Terry and Elizabeth, and thank you to ASTHO for having us here today, and for everyone on the webinar for attending. My name is Kathleen Amos. I am the Assistant Director for the Council on Linkages between Academia and Public Health Practice. I work at the Public Health Foundation. We're here to talk to you today about the core competencies for public health professionals, as you've already heard. Just a couple of housekeeping items as we get started with the presentation. You do have two audio options for listening to the webinar today. You can listen through your computer speakers or through your phone line. If you have experienced any trouble with slow internet connection or problems with the audio online, you might try just dialing in over the phone. I know that's helped people on other webinars I've been on. I believe we have put the link for the slides for today's webinar, as well as a link to the copy of the latest version of the core competencies in the chat box. So you should be able to download both of those from there. We are recording the session today so that we will also be able to provide you with a link to the archive after we're done. And we are very interested in your questions and your feedback on the core competencies, and we encourage you to share those by typing any comments, any questions that you have in the chat box as we go along through the presentation. And we'll be addressing as many of those as we can at the end. We have muted the phone lines for the webinar, so the chat box is your best way to reach us with your question. We ask that you try not to use the Ask a Question feature that you'll see at the top of your screen so that everyone can see the question that you're submitting. I have here with me today also Ron Bialik, who is the Director for the Council on Linkages, and Janelle Nichols, who's our Project Assistant, and both of them will be keeping track of the questions as we go along to make sure that we answer them. Okay, with that, I will get started. So we wanted to begin today with just a little bit of background about the core competencies, but really spend most of the time focusing in on the recent revision that's occurred and what has changed in this latest version. And then just close by mentioning some resources and tools that are available to help support use of the core competencies. So just to begin, the core competencies are developed by the Council on Linkages between academia and public health practice, which is a collaborative of 20 national organizations, including ASTHO. And these organizations are engaged in public health. And the Council on Linkages aims to improve public health practice, education, and research by primarily by fostering links among academia and the public health and healthcare community, strengthening the public health infrastructure in the U.S., and creating a process for continuing public health education. Activities of the Council on Linkages are funded by the Centers for Disease Control and Prevention, and the Public Health Foundation provides the staff support for the Council. The Public Health Foundation is a national nonprofit organization, and we're based in DC. We serve the public health workforce. We focus on improving the public's health by strengthening the quality and performance of public health practice. And we have three primary focus areas of workforce development, quality improvement, and performance management. So the core competencies. The core competencies are a consensus set of skills for the broad practice of public health. And as Terry mentioned, we define this as the 10 essential public health services. And they reflect foundational skills desirable for professionals engaging in the practice, education, and research of public health. The third point on the slide here is perhaps one of the most important point. I really want to emphasize that the core competencies are not meant to be the be-all and end-all, but really they're designed to serve as a starting point for practice and academic organizations as they work to understand and better meet training and workforce needs, workforce development needs. Also, Terry mentioned the core competencies are organized in two ways. We have 8 domains within the core competencies which focus on skill areas within public health. We also have the core competencies organized into 3 tiers, and these represent more career stages, if you will, or are meant to be aligned with people with different professional responsibilities within an organization. So Tier 1 is really aimed at frontline staff or entry-level staff. Tier 2 is more focused on people who have program management or supervisory responsibilities. And Tier 3 is designed for senior management or the executive leadership within an organization. The core competencies are being used by health departments and academic institutions and others across the country. We get a lot of the data on use of the core competencies from the profile study that ASTHO and NACHO do. And we thank ASTHO for continuing to include questions on the core competencies and core competencies use in the profile study, because that really enables us to track how things are changing over time. So the latest data shows that about 60% of state health departments are using the core competencies. About 26% of local health departments are doing so. It's a little bit higher, the percentage is a little bit higher among larger local health departments than smaller ones. And about 90%, slightly more than 90% of academic public health programs reported using the core competencies the last time that question was asked, which was in 2006. So this data is getting a little bit dated at this point, and we are preparing to update it over the coming year. The core competencies are also used by a variety of other organizations. So for example, the Centers for Disease Control and Prevention use the core competencies, primarily or often related to their fellowship and training programs, and also to develop sets of discipline-specific competencies. The Health Resources and Services Administration, and particularly their public health training centers, are heavy users of the core competencies. The public health training centers design training, develop training, and conduct needs assessments, and all of those are based on the core competencies. The core competencies are integrated into learning management systems, like, for example, the TRAIN Learning Management Network that we operate here at PHF, and also appear in national level initiatives like Healthy People. So within Healthy People 2020, there are actually 3 objectives within the public health infrastructure area that are related to the core competencies, 2 of which I think are highly relevant today. These are increasing incorporation of the core competencies into job descriptions and performance evaluations within public health agencies, and also increasing the proportion of public health personnel who receive continuing education consistent with the core competencies. The core competencies also appear in the standards and measures produced by the Public Health Accreditation Board, and I'll talk a little bit more about that in a moment. So we alluded to many of these uses as we talked about who was using the core competencies, but just to highlight them here, the core competencies are being used in job descriptions to develop performance objectives, and then in performance reviews and evaluations. They're also being used to assess competency or assess needs within the workforce, and a lot of this feeds into workforce development planning. And we see a lot of this particularly related to health departments that are preparing for accreditation. The core competencies can be used in training plans. They're being used to develop courses and curricula, as well as serving as the foundation for several sets of discipline-specific competencies, like, for example, the competencies for public health nurses, and also the competencies for public health informaticians. Both of those sets have used the core competencies in their development. And finally, preparing for accreditation. So just to focus on the Public Health Accreditation Board's accreditation for a moment, there really is a lot of consistency between the core competencies and the PHAB standards. And a lot of this does relate to the fact that they're both designed to align with the 10 essential public health services. So for example, within the Public Health Accreditation Board standards, Domain 1 deals with conducting and disseminating assessments, and this includes measures around collecting and analyzing data, which is very similar to what you find in Domain 1 of the core competencies, which deals with analytical and assessment skills. PHAB's Domain 4 focuses on engaging with the community, and in the core competencies you'll see the whole section domain around community dimensions of practice. So there's a lot of similarity, a lot of connections there. Perhaps the most direct connection between the two documents is in Domain 8, which addresses workforce development, maintaining a competent public health workforce, and specifically within PHAB Standard 8.2. So this part of the standards and measures is focused on assessing staff competencies, being able to address gaps and provide training and professional development. And within this, there's measure 8.2.1, which relates to workforce development planning and workforce development strategies. And this measure is one that applies to all health departments that are applying for accreditation, whether they're state health departments, local, tribal, or territorial. Everyone has responsibilities in this area. And within this, there is the requirement for a workforce development plan that is competency-based, and the core competencies are mentioned as an example of a nationally adopted set of competencies. So with that sort of overview, I just wanted to focus in on the most recent version of the core competencies, the one that was released this summer, and talk a little bit about what you'll find in that version, as well as how, sort of how we got to this point. So the core competencies have existed for more than a decade now, and they actually grew out of an earlier set of what were called universal competencies developed by the Public Health Faculty Agency Forum in 1991. So the original set of core competencies dates from 2001, and that document is very different. It looks very different than what you see in the core competencies now. At that point in time, there were no tiers. There was just a single set of competencies, and professionals were expected to be able to perform those skills at different levels based on their positions within their organizations. At this point in time, the core competencies were also very difficult to measure, and this was actually an intentional decision as we were starting out in developing the competencies, because we didn't want people to just see them as a standard right from the beginning. And at the same time, the Council on Linkages also recognized that developing a static set of competencies wasn't going to be particularly useful, and that the core competencies would need to keep pace with changes in the field of public health. So they made the decision that they would revisit the set of competencies every 3 years to determine if there was a need to revise them. The first time that they revisited the competencies was in 2004, and at that point it was decided that there was not really enough use or enough evidence yet to support a revision. But by the time of the second review in 2007, there was now more widespread use of the core competencies. We're starting to hear feedback that the core competencies were working well. People were seeing benefits from using them. And so at that point, the decision was made to start the revision process. So as you could probably guess by the date that was the next date that we have on the slide here, this was a pretty major revision. It took 3 years to complete. That version of the core competencies was released in 2010, and it resulted in a major major changes to the structure of the core competencies. So this is the point at which you see the 3 tiers appear. There was also a shift in focus and a decision to try to make the competencies more measurable as we were getting more experienced with using them. Once this version was released, focus really turned to tool development for the next few years. In 2013, it became time to review the competencies again, and the decision was again made to have some revision. The Council on Linkages didn't want this to be as long or as drastic a change, a process as the last time around. Didn't want to spend another 3 years working on it and have that delay the release. So the decision was made to really focus in, and the most recent version of the core competencies was released this summer in June. And the revisions here really look to address new concepts and how the field was changing, particularly around accreditation and health reform, and also to clarify and simplify many of the competencies. So I mentioned that this process took us about a year, and we just wanted to share sort of the timeline that we went through as we were working on the revisions. So in March of 2013, the Council on Linkages met and decided that it was time for the competencies to be reviewed. There wasn't yet the decision at this point that they would for sure be revised, but this started the process of gathering information to determine whether that revision was going to be necessary. We're always interested and always gathering feedback from the public health community on the core competencies, but this decision launched a formal public comment period. We collected feedback through the end of last year. In September, though, the Council on Linkages met again and considered the feedback that had been received so far through this process. And at that point, the decision was made that revision was going to be necessary based on what we were seeing. We continued to collect and organize feedback through the end of December, and then in January of this year, revisions really began in earnest. So we have a core competencies work group. It's made up of about 55 people, both from practice and academia, and they really sat down and rolled up their sleeves and worked through a lot of the revisions. We produced several drafts of revisions as we were going along, and we released those publicly and tried to collect more feedback on those drafts in order to make the next draft. We really tried to be as transparent and inclusive as possible as we were going through this process. So from January to May, we worked on those revisions, and then in June, the Council on Linkages approved the final revised version. They adopted it unanimously, and the new set of core competencies were released. So I mentioned that we gathered a lot of feedback through this process. We had over 1,000 comments come in from the public health community, and I just wanted to share some of the biggest ones, or the ones that we saw most often, to give you a sense of what we were working with. One of the strongest comments, I guess, that we received was the desire not to have the 8 domains changed. So there was arguments for the idea of potentially adding a new domain, and this came up a lot, particularly with regard to informatics. But we were asked to keep the 8 domains as they were, not to change that structure. And this often related to how people were using the core competencies within, say, needs assessments or learning management systems, where everything kind of rolled up to the domain level, and they didn't want to have to start all over again with their systems. We were also asked to look at clarifying and simplifying the competencies. We got a lot of feedback that the concepts within the core competencies were good, but that the language that they were written in was hard to understand. So could we look at trying to simplify that and make it a little more practical? And also along with this, to look at making sure that each competency statement really represents only one skill or competency. We were asked to add new concepts, particularly, as I mentioned, in the areas of health reform and accreditation, how those were impacting the field and what skills were going to be needed going forward to work in this new public health environment. We were asked to add more examples, and also to reorder competencies, so to put the competencies within each domain in a more logical order related to how skills progress. So to have a progression from competencies that dealt with skills of less complexity to higher complexity. But at the same time, not to move any competencies from one domain to another. And that related, again, getting back to the first comment about how people were using them within their systems and wanting to be able to continue to compare data over time. We were asked to consider adding another tier to the core competencies. And this came up a lot related to Tier 1 and where clerical or administrative support staff fit within the current structure. And then finally, we were asked to help with use of the core competencies. So we got a lot of feedback that the core competencies were good, but people needed more tools or needed more assistance really integrating them into their workflow. So I just wanted to share some examples of how we took this feedback and how this feedback influenced the revision of the core competencies. And this one here, to start out, is probably my favorite of all of the examples. So we really spent a lot of time focusing on clarifying and simplifying the language. So for example, in 2010, we had a competency that read, applies communication and group dynamic strategies, e.g. principled negotiation, conflict resolution, active listening, risk communication, in interactions with individuals and groups. In the 2014 version of the core competencies, this has become facilitates communication among individuals, groups, and organizations. So you can see how it's kept the same core concept, but it's presented very differently. And we hope that the attention that we paid to this type of revision will really help make a difference in how easy it is to work with the core competencies. We did add more examples, and the way that we did this was in the form of EGs. So for example, in 2010, we had a competency about negotiating for the use of community assets and resources. In the 2014 version, we tried to give some more examples of what these assets and resources might be. So Boys and Girls Clubs, public libraries, hospitals, faith-based organizations. We really wanted to give people a little more context to be thinking about as they're working with the core competencies. Going along with the idea of simplifying and clarifying, we tried to reduce jargon as much as we could within the competencies. So for example, in 2010, we had a competency about incorporating systems thinking into public health practice. Not sure that systems thinking is always the most understandable concept. I will admit to not having understood it when we started this process. So we really tried to think about what systems thinking entailed. And I actually think there are a couple of competencies. It's reflected in a few competencies in the new version, but one of the biggest ones is to be able to explain the ways public health, healthcare, and other organizations work together or individually to impact health within a community. We did add new concepts. So for example, advocating for the role of public health in providing population health services, or ensuring development of community health, state health improvement plans. These are both competencies that were not represented in the 2010 version. So we've tried to put some effort into making sure that we're capturing new concepts to keep up with changes in practice. In addition to adding new concepts, there were also areas where we expanded on concepts that were, they were already in the core competencies, but we wanted to give them a little more detail. So for example, we did have in 2010 competencies around evaluating programs. In 2013 or 2014, we've tried to really break this out a little bit more. And now we have several competencies that relate to the importance of evaluation, actually doing the evaluation, and setting yourself up for continuous improvement based on the evaluation. In addition, we did make some other decisions based on the feedback that we heard. So we did keep the 8 domains as they were. Both the number of domains and the topic areas remain the same from the 2010 to the 2014 versions. of the core competencies. We did look at reordering. We did try to reorder individual competencies within domains to ensure a more logical progression in skills, but at the same time we did not move any competencies from one domain to another. We did pay a lot of attention to whether each competency was only capturing one skill and making sure we dealt with areas where that wasn't necessarily the case in the last version of the core competencies. And the idea of developing an additional tier is actually something that's still under discussion with the Council on Linkages. So we got sort of votes, if you will, from the community for and against this idea, with some people saying that it would be really helpful to have an additional tier to capture clerical, to better address the needs of clerical and support staff, whereas other people saying that they fit very well within the Tier 1. So we haven't yet, the Council on Linkages hasn't yet made a decision on that. They decided to revise the existing 3 tiers first, and then they'll revisit this idea. So we'll be having a lot more discussion about this in the very near future. And finally, we are working to revise and develop tools. Those tools that will help with making the transition to the new version of the core competencies, as well as help with integrating the core competencies into workforce development activities. So once the new version, the revised version, was released in June, one of the first things that we did was develop a crosswalk of the 2010 version of the core competencies and the 2014 version to show the relationships between individual competencies within the 2 versions. We also updated, we have a set of self-assessment instruments on our website, and we updated these to reflect the new competencies in the 2014 version. The next 2 are an ongoing process, so we are building collections of job descriptions and workforce development plans that incorporate the core competencies to be able to provide those as examples for people as they work to develop their own plans, their own job descriptions. And relatedly, we're always interested in examples of how organizations are using the core competencies. We love to be able to highlight good examples of use on our website as, again, as ideas for others as they're working on their own efforts. And each one of these should be a live link, so you should be able to go right from these slides to any of those resources. We're also working on, we have a few more tools that are sort of a work in progress at this point. We do have a competency prioritization tool. It's a fairly new tool for us that deals with assessing gaps in competency and then figuring out where you might focus your efforts in terms of workforce development. And this tool, as we're starting to use it more within the field and as other organizations are using it, we're going to be looking to modify that based on the feedback that we're receiving. We are also currently working on a competency checklist for course providers. And this is something, a suggestion that came actually from our train community, where it was, we were, I guess, reminded that the people who are developing courses are not necessarily always the same people who are loading them into learning management systems. So anything that we could do to help make the process of assigning core competencies to courses easier would help ensure there's more competency, or it's more obvious what training is competency based. So we're putting together a checklist that will help in that area. And we are also compiling popular questions. We answer questions here at the Public Health Foundation about the core competencies. So we're putting some of the more popular ones together and making those answers available online. And again, we're always interested in hearing what tools would be useful for people who are actually working with the core competencies. We want to be focusing on developing items that will help you all use the core competencies. So we're happy to hear your suggestions there at any time. And so with that, I I will pause for a moment. And we really wanted to have some time in the webinar today to be able to hear what questions you have and hopefully answer them for you. So I know Janelle and Ron, I think, have been keeping track as we go along. Janelle is going to make sure that the questions get read out, and Ron and I will do our best to answer them. Do we have any questions?
No questions at the moment, so feel free to go ahead and type those into the chat box, and we will read them aloud.
Okay, it looks like questions are starting to come in.
Okay, so Amy is wondering, what suggestions do you have for developing core competency assessment formats that are not separated out by the 3 tiers? She continues that we do not want to miss assessing higher level competencies that may exist for staff who identify as Tier 1.
It's an interesting question, and actually brings up a very good point. So the core competencies are designed in 3 tiers and are meant to most closely align with responsibilities of the various people within the tiers. But it's not necessarily the case that one person may only belong in one place. I'm not explaining this particularly well. But it may be the case that for an individual or for a group of people, competencies from multiple tiers apply. And so when working on competency assessments and competency resources, we've had a lot of feedback from groups who are simply pulling competencies from various tiers and kind of mashing them up together. I mentioned the core competencies are designed as a starting point and not the be-all and end-all, and we really do encourage you to modify them to pull out what's most relevant for your health department. And use them in a way that makes sense within your organization and meets your organization needs. There's no necessarily rule that you need to keep the strict structure that we have within the core competencies. I don't know, Ron, if you have anything to add to that.
The only thing I'd add is that sometimes if a person is drawing from all 3 tiers, if you will, there's still, if you're doing an assessment, a paper assessment, you probably do need to pick a tier that you think is most appropriate for that particular type of position. And let's say the individual does a self-assessment and assess themselves very highly on many of the competencies. Let's say they're Tier 2 and and in that category, let's say everybody rates themselves very highly. The assessment tools, while they are quantitative in that people respond quantitatively, they really are qualitative instruments meant for discussion. And so if everybody rates themselves a particular way, if you see that often, it's really up for some discussion. Now also, if you're using it for individuals and trying to use it for setting up professional development goals for individuals and talking through where they may stand, again, it's the same thing. Regardless of how somebody assesses themselves, whichever tier they assess against, it is an opportunity for discussion.
Excellent.
Great, okay, and we have another. Is there a Core Competencies 101, an online overview for supervisors that would help us introduce these core competencies?
That is a very good question. So I believe we don't actually have one, but it is something that we have heard from a number of people to look at developing something like that. So it's a very popular suggestion. I do believe that there are, I can't remember if it was a group in Florida, I think on the Train Learning Management Network there are a few examples of courses that other groups have developed that provide sort of a 101 on the core competencies. We haven't actually created one ourselves yet. Add it to the list for the future.
Great. Please feel free to, one more question. Okay. Where is the emerging public health informatics placed?
Informatics is that's a good one too. I mentioned that we had suggestions about creating additional domains, particularly in the areas. A lot of it comes up often in relation to informatics. And we made the decision not to create a new domain for informatics, but to try to incorporate informatics throughout the existing domains. So you'll see some specific competencies that mention informatics, and we also, within the, let me think of which section it is, within the public health sciences skills section of the core competencies, there are competencies related to applying the science of public health to practice. And informatics, we actually included in that area as well as one of the sciences. So giving the impression that you should be thinking about how informatics is changing or how information technology is changing the environment that we work in sort of all the time in your practice.
Okay. I have a question for Ron. How much discussion is taking place between the Council on Linkages and the Association of Schools and Programs of Public Health around competencies and curricula development?
Well, that question looks like it's from Terry. Thank you, Terry, for asking it. And a couple of ways to respond to that. One is that the Association of Schools and Programs of Public Health is a member of the Council on Linkages. So that's one part of the discussion. And as Kathleen had mentioned, the vote was unanimous for adoption of the competencies, which suggests that ASPPH is using them as well. Secondly, ASPPH has invited us to participate with them on a webinar. Kathleen, the date is?
January 28th.
And the purpose of the webinar is to go through similar content that Kathleen went through today, as well as there'll be a panel of faculty who will be talking about how they're using the core competencies in their curriculum development, teaching, continuing education, etc. While you didn't ask the specific question, Terry, there's also discussions that we've had with another Council on Linkages member, the Association of Prevention, Prevention,
Teaching, and Research.
Thank you. APTR. They invited us to talk with them during their meeting at APHA, and we had excellent discussions with faculty about how to use the competency for teaching within the public health programs, but also they talked about interdisciplinary programs as well. Terry, I hope I answered your question.
Okay, we have another. How have you found that the core competencies have been useful in encouraging and or promoting cross-discipline workforce development, for example, with public health and hospitals?
Well, another good question. Interestingly enough, we at the Public Health Foundation for the past couple of years have attended the Association for Community Health Improvement annual meeting. ACHI is an arm of the American Hospital Association. And last year we were quite curious because the number one document that was being picked up at our booth there were the core competencies. And we decided to start asking people why they were picking those up. And the most common response was, we have these new responsibilities for our hospital. We're doing the community benefit work. We're doing other activities. We've been given these responsibilities, but we don't know what we need to know. And they would see the core competencies for public health professionals. They said, this is telling us more of what it is we need to know, which was super. That led us to submitting an abstract for the March 2015 ACHI meeting, and they've accepted that, and we're going to be doing a workshop there where we'll be breaking folks up into groups, and we'll be looking at the core competencies for public health professionals, but with a, quote, population health eye. And what we're going to be asking people is, how can we take these competencies and make them speak to you and pull out what you believe are priorities for delivering population health services by the hospitals? And so it's an area where it's pretty new to us, and it's exciting that the hospitals seem to be so interested in it, and we will do everything we can to engage them and keep them engage. We've shared with the AAMC and other organizations the core competencies. But with the hospitals, that's been a real engaging and exciting activity.
Okay. Is public health emergency preparedness in the core competencies?
The core competencies, we typically, as you can tell as you go through it, we don't have specific disciplines per se within there, and we look at preparedness as a discipline within public health. If you look at the competencies in terms of surveillance and in terms of communication, in terms of cultural competence, et cetera, we believe, and the members of the work group and the council would say that they speak to the particular areas of emergency preparedness. Now, for any of the disciplines, we also see discipline-specific competencies. So you start out with the core as the foundation, and then for some disciplines, they dig a little bit deeper. And the preparedness area, there are the preparedness competencies and capabilities that CDC has worked on with its partners at state and local levels. You'll see epidemiology competencies. You'll see informatics competencies, a variety of disciplines that build on what it is that we have in the core. Oh, and I left out nursing. Public health nursing is probably the one that's most rigorous in updating their competencies each time we update the core competencies.
And is performance management included in the core competencies?
Oh.
Ron's favorite.
Yeah, right. Love the question. Performance management and quality improvement both are. I can't recall exactly which domain, but the ability to develop and the ability to implement a performance management system is actually in the core competencies. In terms of quality improvement, there are several areas where we talk about the ability to not just assess, not just to evaluate, but to actually use the results to improve programs in the organization. But performance management is very explicit in there. We tried for this round to be sure that some key concepts and requirements from the Public Health Accreditation Board were in this version of the competencies. So you'll see strategic plan, you'll see community assessment, you'll see community health improvement plan, performance management, quality improvement, some of these key areas that are addressed in PHAB.
Okay. Any more questions from anyone? We can go ahead and open the phone lines if you like, and then we can feel free in a couple. I'll let you know in a couple seconds. You can go ahead and.
You are now unmuted.
So the phone lines are now open. If anyone would like to have questions, comments, feel free.
Right. And if somebody has a different answer than the answers that we've provided, please speak up.
And you may, if you do not have a question, you might at this point, if you haven't already, want to put your phone on mute, just so we don't hear if you happen to be talking to someone else. So we'll give that a few minutes, see if anyone has any comments.
Okay, I have a question. Is there any work being done to carve out Tier 1 as a possibility and cross-reference with work being done in the area of PHW?
Community health workers, right. You know, at this juncture, there isn't. And it's a really good question because people have suggested that Tier 1 speaks to a lot of different groups, if you will. That Tier 1 may speak to individuals going through baccalaureate training in public health, for instance, individuals who are newer to the field, individuals who may be administrative, and as well as community workers. But we have not done anything specific with that area, and it's an area that I think is ripe for doing some work.
Yeah, and there are sets of community health worker competencies being developed. I know we have several sets that have been shared with us.
Great. Okay. Have you thought about collaborating with the Interprofessional Education Collaborative for cross-disciplinary learning?
Kathleen, I believe that came up during our APTR discussion, but I think it came up, and that was really the first that we had heard of it, so I'm glad that you're mentioning it, and it is, so we had not thought of it until APHA, and it's something that we need to be following up with APTR since it came up during that meeting. If you have other suggestions about that, please let us know.
All right. We thank you for all of these questions. This is very great feedback for us and things for us to think about. We also would encourage you, if you have feedback on any of the questions that we have on the slide here, we'd love to hear it. So we would love to know how you or your organization are using the core competencies. That helps us think through how we can better support you in your effort. So if anyone is able to share what they're doing, if you type that in the chat box, we'd love to see that as well.
And I have another question. How do public health finance core competencies fit into this?
So public health finance we have a domain. Domain 7 deals with financial planning and management skills. You'll find a lot about finance in that particular domain. Competencies related to budgeting, both at the programmatic and organizational level. Competencies related to understanding, if you will. I know that's not an approved competency word, but being able to explain and make use of the funding mechanisms for public health and healthcare. Have competencies related to negotiating contracts and using different financial analysis methods in terms of being able to make decisions about your programs and services. So there are a number of financial related competencies in that domain.
That's often a domain that in discussions with our academic colleagues comes up, is that a lot of what's in that domain one might expect to be something that's taught within the agency, not something that's necessarily taught through an academic program. Some of it would be, but to really develop the competencies, it's something that often requires the continuing education and training within the agency itself.
Hello?
Hello. You have a question?
I'm Slides from Clinton County. I just wanted to say I think some of the financial planning and management skills really goes through everything that we do, because if you're working with grants, whatever you're working with, that is one piece of it. I think that we were a little shaky on it in the beginning, but this is like kind of one of the biggest pieces of what we're doing. I mean, so it kind of permeates everything.
Yeah, that's a very good observation. Yeah. Thanks. Any other questions? All right. Well, we're getting close to the end of our time here. Again, thank you for your questions. It's been really great for us. We would encourage you, again, if you can want to share with us how you're using the core competencies, we'd love to hear that. And also, if you have ideas about what would help you or your organization make better use of the competencies, if you want to type any of those into the chat box, we will take them and use them as we think about what tools to develop next, what resources to provide.
Can I say something else? We use the core competencies when we do evaluations on our people, no matter what their profession is within public health. And it really helps us because what we're looking at are all the tiers. And if we see somebody that is continually working either above or beyond sort of the tier they should be in, that really gives us notice to say, well, you know, this person, it may be time to move them up to a higher level of management or of working. And those that perhaps aren't, it's like this is where maybe we should put some of our resources for learning and developing a person.
Oh, yeah, that makes a lot of sense. That's a great example. Thank you. Excellent. Well, if anyone else has any other suggestions or feedback about how you're using it or what you'd like to see us do, please share. So just to wrap up today, we wanted to share a couple other ways or types of support or assistance that are available in addition to the tools that are on our website. Ron mentioned that this webinar today is actually part of a series of webinars that we're doing. We did a webinar yesterday with the National Association of County and City Health Officials. That was really great as well. And we do have one scheduled in collaboration with the Association of Schools and Programs of Public Health for the end of January. So if anyone is interested, wasn't able to, if you know of people who weren't able to attend today or others that you think might be interested in this webinar, please feel free to share that information with them. All of the information about the webinar is available on the Public Health Foundation's website. We also have a couple of approximately monthly newsletters that we put out here at PHF. So we have a Council on Linkages update, which is focused specifically on activities of the Council on Linkages. So this almost always includes information about the core competencies, so announcements when new resources are available, when webinars or other training opportunities exist. All of that information about the progress or the activities that are occurring with the core competencies is shared through the Council on Linkages update. So if you are interested, if you did not receive that and you're interested in doing so, if you want to just send Janelle a quick email, she'll make sure that you get added to the list. The Public Health Foundation also has the e-news, its e-newsletter, and that pretty regularly includes information about the core competencies as well, so that's another option for keeping up with what's happening with the core competencies. We are also always happy to answer questions. Heard some great questions here today. If you think of some after the webinar that you didn't get a chance to ask, we'd love to hear them. Or anytime in the future as you're working with the core competencies, please feel free. My email address is on the slide here. It's also in the core competencies themselves. Feel free to send me an email anytime and we'll do our best to try to get your question answered. And then just to leave you with some links to a few additional resources. On this slide here, the Council on Linkages falls within our Academic Practice Linkages unit at PHF. So there's a link to the Council on Linkages on the slide here. If you're interested in more information about the Council, about the core competencies, or any of the Council on Linkages initiatives, you can find a lot of that online. There also, we wanted to make sure we share the direct link to the TRAIN Learning Management Network. TRAIN currently has over 875,000 registered learners, over 29,000 courses. The core competencies are built into the TRAIN system, the competency-based system. So once you've identified areas in which you would like to develop skills or you'd like some competency-based training, you can go into TRAIN and search for courses that will help you meet those needs. So with that, I don't know if there's, let me just check, any final questions before we sign off?
Your count is
One more.
All right, what did you take away from all that?
Do you address in the assessment of core competencies how to address or overcome standard biases that are still existent in certain fields of public or environmental health that may limit certain groups, such as women, in gaining skills for core competencies?
I would say that the short answer I would say to that is no. I mean, the assessment instruments that currently are out there are basically repeating the competencies themselves and asking questions around that, and I don't believe any other consideration has been given to altering it that way. But that may be something we may not be entirely understanding the question, and maybe that's something we could take.
You are now muted.
We would love to hear more about that if you provide us with your contact information or send us an email. We'd love to learn more about the question and explore what answers might be reasonable.
Yeah, that sounds great. Ron's right. We've heard of people developing different types of assessments, but so far I haven't heard of anyone who's really looked at what to do in that sort of capacity once they've done the assessment or in doing the assessment. It looks like we have one more question here about the cost of using Train. So for an individual learner, Train is free. You can create a free account at any time. A lot of the courses, the majority, I would say, of the courses in Train are free. There are some courses that do cost money, depending on the particular course provider. But just signing up for Train is free. All right. Well, thank you so much. Again, I want to thank ASTHO for having us here today. It's been really great for us to be able to talk about the core competencies and learn a little bit more about how you all are using them. I thank Terry as well for giving a great introduction at the beginning of the webinar. And we thank all of you for listening. That's all. It doesn't look like there's any further questions. So with that, we will say goodbye. I hope you enjoy the rest of your afternoon. Thank you.
Thanks.